Hi everyone, my name is Sophia and I am the CHAMP coordinator at UCI. Today we'll be speaking about different pathways to a health career. And as always, this workshop is brought to you by the Careers in Health Accessibility Mentorship Program at UCI. So let's do some introductions of our panelists today. We'll be going in alphabetical order, starting with Brianna.
Hey everybody, I'm Brianna. I'm a third-year college student at Cal State Long Beach School of Nursing in my second semester so far. And I guess a fun fact about me is that I'm at a boba shop right now, so if you hear music and stuff, sorry about that.
Gianna, I think you're next. Can you hear? Oh, not working. Sorry. Okay, I'll send you a message. We'll go with Jennifer and then we'll fix Gianna's audio.
You're good. Hi, hello everyone. My name is Jennifer. I'm currently a fourth year BUS. I major at UCI. And then a fun fact about me is I've studied abroad in Thailand.
I can go ahead and introduce myself. My name is Hannah. My pronouns are they, them, or she, her. I am a third year at UC Irvine studying public health sciences and minoring in medical humanities. A fun fact about me is in the next 6 months, I'm going to be interning with Planned Parenthood and with an integrative medicine clinic. So it's a little bit of two polar ends of healthcare. And so if y'all are interested in either of those things, you can feel free and reach out. We'll be providing contact information, stuff like that later on.
Hi, everyone. My name is Yukta, and I'm a third year human biology and society major at UCLA, and I'm minoring in global health. A fun fact about me is that I've recently started getting some plants, taking care of my plants. So yeah, that's exciting.
Cool. Okay, is Gianna, I think Gianna's back, but can you hear her? Is your audio okay now? If not, we'll work out your audio and then we'll introduce Gianna in a second. She's okay here. Okay, yeah, she'll be back. We'll present the next slides. So today we'll be talking about broadly health careers, and we'll be specifically focusing on physician assistant, nursing, pre-vet, and pre-dentistry. So here we go.
There are a lot of health careers, a lot of options, and things are always growing in the field too, but some of the ones listed here are dentist, orthodontist, optometrist, physical therapist, nurse practitioner, radiologist, surgeon, EMT, physician, physician assistant, pharmacist, pharmacy tech, nurse, nursing assistant, and veterinarian. And some of the very common pre-health majors, according to the American Medical Association, for pre-med students specifically, but this can still broadly be applied to pre-health majors, are listed here. And as you can see, most of the matriculants, so the people who enroll in the college, they're biological science majors. And then surprisingly, or interestingly, I think, the least is math and statistics. So those are just some facts about the demographic of majors that students usually have when they're pre-health and they're enrolling in college. And so the thing is, not every pre-health major or not every pre-health career has a major that will definitely get you into professional school. I think if you go to maybe presentations or talks with professional schools like vet schools or med schools or like PA schools and stuff like that, mostly all of the representatives will tell you that there's not a particular major that will like guarantee your admission into that school. There are some careers like nursing that actually have like a nursing major. There's typically, I've never heard of anything like a pre-med major I don't know if that exists, but typically that's not something. But for some professions like nursing, you apply to nursing school, and then there's a nursing major specifically. And then to become a veterinarian, some of the common majors are chemistry, physics, biochem, biology, animal biology, or zoology. And then for dentists or pre-dental students, some common majors are bio or chem. Oh, by the way, if you guys have any questions at all, feel free to drop them in the chat and then we can answer them. So I think a really commonly asked question is, will certain majors help you have more success? And the short answer is not really, but the longer explanation is that it really depends on the prereqs of your career choice. For example, I'm a pre-med student, so in order to apply to medical school, you have to complete a set of specific classes. But it doesn't really matter what major you are. You can still major in history or dance or anything, and you can still complete the classes that you need in order to go to medical school, vet school, dental school. The only difference is that if you do a science major, you'll have overlap in your major requirements and the prerequisites for the professional school that you want to go to. So it kind of just allows for smoother transition when you're picking your classes. But there's really no rule for what major you should be. And applications to these professional schools are usually holistic. So your class, your work, your research, and extracurricular activities are all taken into account. And if you do decide to do like a non-science major, it'll just give you a different perspective when you're applying, and you'll probably have something unique to write about if you don't want to major in a science, like a hard science major.
Before we move on, do we have any questions about majors and any questions for you specifically? And while we're waiting for some questions, I think Gianna's back. So if you are back, do you want to introduce yourself, Gianna? Cool.
Hi guys. Sorry, one sec. Okay, can you hear me?
Yep.
Okay. Hi guys, I'm Gianna. I'm a second year at UCLA, and a fun fact about myself is that I can play the harp. Yeah.
Okay, so yeah, Gianna will be talking about the pre-dentistry in a couple of slides later. We do have one question from Manny. He says, what is the definition of a pre-med program? Are there minimum credits in anatomy, physiology, etc. needed for admissions to medical school? Yukta, can you answer this question?
Yeah, so a pre-med program is some schools, some colleges, undergraduate institutions will have like a pre-med committee that will help you be on track and like help you with what classes you're supposed to take, what extracurriculars you should have, etc. UCLA does not have one. So if you go to UCLA, you'll have to keep track of everything yourself. I'm not sure about UC Irvine. Maybe Soph can. Okay, UC Irvine doesn't have one either. So some schools won't have programs. So in that case, you would keep track of everything yourself. And in order to keep track, you kind of have to do self-research, or I'm sure this club can also help you in the future, or clubs like this. There are probably organizations at your school that are run by students that can help you kind of keep track of your career path. And as for minimum credits for specific courses, it actually depends on each medical school. Most medical schools have like similar requirements, but it differs for each medical school. So like usually med schools don't actually require anatomy and physiology, but I know that other pre-health programs do. So you would go to find out the requirements, you would go to a possible medical school that you're interested in and see all of the requirements on there. There's actually also databases that like third-party companies have gathered, and you can look for like huge lists and stuff. So yeah, the downside is that some universities that don't have these pre-med programs or like support, you're kind of left on your own to figure out how you're going to get there.
Yeah, thank you, Yukta. And we have another question from Sandra. She asks, If we choose a non-science or STEM major and we need to take prereqs, will those prereq classes be difficult to take because they're impacted and are given priority to STEM majors?
That's a great question about the priority to STEM majors. If you go to a larger school, I do think it is difficult to get the classes you may want, and especially if they're restricted to that certain major. But what I've noticed is that typically the upper division courses are restricted by major, and so the prereqs, at least at UCLA, the prereqs that you would need for medical school should be open to all undergraduates regardless of major. So based on major, for the lower division prerequisites, you shouldn't have like a problem depending if you're a humanities major getting into that course. As for them being difficult, oh my gosh, sorry. As for them being difficult, they are difficult, but you'll be in the same boat as everyone else who's taking that class and wants to go to med school anyway, so you won't be alone because you're a humanities major. So if you have any worries about that, I think you'll definitely have a different experience, but depending on the school, you probably shouldn't have major restrictions until you get to your upper division level. And usually upper division courses are not prerequisites for medical school. They're just for your major. So yeah.
I agree with everything that you've just said for UCI as well. The one thing about UCI is your major, like pretend you are a bio major, you do have first dibs, like you do have priority for bio classes. So people who are not in bio may have to wait longer, and then you will still get your class, but you might not get the professor or the time that you want. One pro to being a major is that you can take classes wherever, really, like if you wanted to take your prerequisites for med school at a community college or in a different college, that is completely acceptable. If you do commit to like a bio major at UCI, you have to complete all the prerequisites for bio at UCI. And Mason, to answer your question, most of the time pre-med as a major is not, for most schools, it's not a major in itself, but I can't speak on all schools. There may be some schools that have like a pre-med program. I know that there are direct programs as well that you can just go there for your entire undergrad and medical school. So that might be something you would like to look into. Cool. Okay, so if that is all of our questions, let's move on to Hannah to speak about physician assistant.
Hi everyone. So again, my name is Hannah. Before I start, if you have any questions about the physician assistant career, please feel free to just put it in the chat whenever you'd like, or you can save that question and turn on your audio if you want at the end, up to you. And so I wanted to start off by saying, before we start to talk about what a physician assistant is and what they do, I wanted to kind of give y'all a fun fact, but PAs or physician assistants were the #1 spot for both the 100 best jobs list and the best healthcare jobs list in the US for 2021. And so that's a pretty big position to hold on to, right? #1. And I'll kind of talk about why I think it rose to #1 and why my reasons were to change from pre-med to physician assistant, because I was pre-med before. And so the general pathway to become a PA is once you complete high school, you would enter a undergraduate program, and there you would fulfill your prerequisites and gain some experiences. And then you can apply to a PA program, and most of them are 2 to 3 years, and it's a master's degree. You do not need to go to any other further schooling afterwards. But after you complete that PA program, you would need to take a certification test called PANCE. It's pretty similar to the nursing route where nurses would have to complete the NCLEX. So I would compare it to that. And so some requirements to get into a PA program are on the next slide. These are some general course requirements. So a lot of the ones we see here are classes that you would most likely finish as general education requirements. So that would be their first 2 years in university, meaning you would probably do your English requirements, like general math requirements, things like that, humanities, language, all of that. The ones I would really emphasize would be human anatomy, physiology, microbiology with lab, and those were the ones that I would focus on. They also require either general chemistry with lab or organic chemistry with lab. Some require both, and so I would recommend to check out the schools to kind of see what those prereqs are, because it does depend depending on what schools interest you. And that last bullet point that says clinical healthcare experience, that says about 1,000 hours, kind of wanted to elaborate more on that. There are 2 different types of healthcare experience. There's general healthcare experience, so HCE is what pre-PA folks kind of talk about it like. And then there's also patient care experience. So healthcare experience could mean maybe some of you that are interested in healthcare careers have volunteered at hospitals or maybe shadowed at clinics. That would be considered healthcare experience, whereas patient care experience would be considered positions or roles where you're directly helping someone. So for example, I've been trying to gain patient care experience hours as a caregiver, where I'm helping transport, treat, medicate clients or patients that I see. And so that would be considered patient care hours. And healthcare hours and patient care experience hours, you need at least 1,000 to be competitive. In addition to that, the PA field really requires, or I don't think it's a requirement, but I would say it's something that you should do, is to shadow physician assistants, because they really want to see a holistic applicant. And that's one of the reasons why I was really drawn to PA as a profession, because the application process is one that really focuses on your direct experience with healthcare. And so it really forces you to get into the field and make sure this is what you want to do before you commit to it. And that's something I really appreciate. And in addition to that, there are some GPA requirements. Usually I would say it's a 3.0 cumulative and science GPA. Some do require like 2.5 GPA. And so it is more approachable compared to maybe some other grad schools. And so that's something that really appealed to me as well. And so on the right-hand side, you can also see a few PA schools in California. There are a lot that are opening up across the nation, but California is a really great place to become a PA, because there are different state laws that kind of determine how much independence a PA can have in their practice. And so talking about their practice, the next slide talks about responsibilities and more about the career itself. So as a PA, you can do a lot of things that physicians do as well. You can take medical histories, conduct physical exams, diagnose, treat illnesses. You can order and interpret tests and medication, develop treatment plans for long-term patients as well. You can help perform in procedures and assisted surgeries, make rounds in hospitals, nursing homes, different healthcare environments, and you can also do clinical research. Something I would really like to emphasize too is that if you're interested in surgery, being a PA is a really great role to have if you are interested in it, but don't necessarily want to go the surgeon route. I know that someone else is presenting on nursing, and an example, because a lot of people compare PAs and NPs, nurse practitioners, but if you are more interested in, say, psychology as a specialty, there aren't as many PAs that have been kind of growing in the psychology field or psychiatric field. And so it's just important to kind of do your research and see, if you're thinking about specialties and things like that, way beyond like if you are interested in healthcare. It's important to kind of think about what professions align with what specialties. And on the right-hand side, you can see some other facts that Sophia put in. And I kind of want to just quickly talk about why I chose to be a PA, or why I'm in the pre-PA route. So I mentioned earlier that I was pre-med for most of my life until maybe when I hit 19 years old. And the reason why I chose to be a PA was mostly because of work-life balance, since the schooling isn't as tedious or as long as other fields out there. That was really important to me. And I don't know if I want a family, but if I did, I would want to make sure I had time for that. That was something I considered. Another thing that was really important to me was wanting to increase accessibility to healthcare as soon as I could. Again, I was not really sure if going the med route was for me because I didn't know if I could see myself being in school for a longer amount of years. And so if that's something that you resonate with, maybe that's a good sign. And the biggest reason why I wanted to be a PA is lateral mobility. And so being a PA, the most special thing I think that PAs have is the ability to switch specialties throughout your entire career. And so say, for example, if you wanted to go pre-med route and you wanted to do ophthalmology, you have to go a very specific route for schooling for that specialty and do a residency program for that specialty. And once you're in it, you basically can't switch specialties unless you go back to school. But if you were a PA, if you were interested in, say, women's health or OBGYN, you could do that. And then if you wanted to switch things around and go into family medicine, you could do that. And so that was the main appeal for me because I'm someone that kind of wants to dip my toes in a lot of different fields and be a well-rounded provider. And so, yeah, those are the reasons why I decided to be a PA. It's a really great field, and I didn't learn about it until very late into my undergraduate schooling. And so I hope that, you know, even if y'all have never heard of physician assistants before, it's something you can look into. I highly suggest at least seeing what it's like, because it is a really, it's a growing field. So it's nice to look into it. And that's pretty much it for my section. I see someone has a question. Cielo says, I don't plan on being a PA. I would like to be an oncologist. However, I've been wondering how PAs and doctors deal with grief. I know professionalism is important, but it must be difficult. Yeah. Well, I would want to first say that there are a lot of oncology or PAs that practice oncology, and so it's something you can look into too. But I've actually talked to my mom, and I have a few PA mentors. My mom is a nurse practitioner, and she's talked to me about a lot of cases where she sees younger folks or really intense cases where she can really empathize with the patient that she's seeing. And she'll never forget it, you know, like watching that process. And I would say that, you know, I've read a lot of articles where folks talk about like, there was a movement a few years ago about how like whenever a patient, you know, like passes away, the providers, the workers there, they will take like a second just of silence to honor that person passing. And I don't know if, you know, like I haven't really experienced that myself, but I'm sure that folks that experience a lot of death or grief within the field, it's something to kind of just take respectfully and just have patience with it. I think it gets easier over time. Can't really answer it completely since I haven't experienced that myself. But yeah, I definitely think that it's something that you actually might learn in medical ethics as well. So I recommend taking a course like that because we did talk about different things like advanced directives and what to do when you have to make those tough medical decisions. So yeah, I don't think I answered that question that thoroughly, but I hope that was helpful. And Manny says, what practices can PAs or what practices a PA can or can't do compared to an MD? That's a really great question. And so I didn't go over that, and I probably should, so I appreciate you saying that. But the thing that I would say, it kind of goes along with Thomas's question right now, difference between a PA and MD. PAs cannot open their own practice. Nurse practitioners can, MDs or DOs can, but PAs need to be legally, I would say, legally bound to a physician. And so I know a lot of PAs, especially in dermatology, that open their own clinics in the OC area, but they must have a practicing physician sign with them to open up that facility. And so I have been shadowing a PA recently, and I asked him, because he's at a like family health clinic. I asked him, like, do you have to have a physician sign off your paperwork before you can diagnose or prescribe medication? And he said that it's very, I would say, informal. Like in law, it does say that you have to have a physician kind of sign off and make sure that that PA is doing what they're supposed to be doing. But in practicality, it's something that the physician has to do, even for the NPs that were also working at the same clinic. And so it definitely depends on what state you're in. In California, PAs do have a lot of independence, but it's something that the PA union is working on, because it's more of a hiring issue. A lot of PAs can run into difficulties of being hired compared to NPs, because NPs have a really strong union, or nurses have a really strong union, and they have those rights already made. And so, yeah, there's a lot of things that are all legal details, but PAs can do a lot of things that MDs can do. It's really just looking at the steps of getting there. And if I would also say another thing is your personality. I personally don't mind being someone that's helping a team rather than leading the team. And so that's just something to know as well.
Thank you, Hannah. We do have one more question for you that was sent to me. It says, where did it go? Sorry. It says, would you be working as a caregiver part-time or full-time? And how do you balance school, work, and your job?
That's a good question. Since December, I've been a caregiver part-time, and I actually work, well, I guess if that person wants to contact me personally, feel free to, because I'm not going to say where I work, so I don't want to speak for them. But the company I work with is very flexible. And so there are times where I'll work like 15 or 20 hours a week. And then there are times where I don't work at all in a week. And so I would pick up shifts dependent on what patients need help then. But I would say that the quality of patient care experience is really important. And so I'm planning on getting like a medical assistant position after I graduate to get more hours. But yeah, if you wanted more information on what being a caregiver is like, you can also reach out to me. I don't want to take up too much time, but I would say balancing work with school and with personal things, it is pretty difficult, but I think everyone here could agree that, just staying organized and focusing on, like, this is my passion, this is what I want to do, the perspective and rewriting that narrative of focusing because this is your like life goals or your passion really helps. Burnout is real, and you'll definitely experience it. I'm sure a lot of people here have experienced it, but just remembering to keep yourself grounded and focus on your goals is really important. And so also don't take on too much. Definitely focus on your school first, because you can always work after you graduate. And yeah, please do that, because I wasn't focusing as much my first few years of undergrad. And so if I could go back, I would just say really focus on your undergraduate schooling and just getting used to school as well, because college life is really hard to get acclimated to, and you all should experience a lot of great things. So just focus on everything that means a lot to you, I would say.
Thank you, Hannah. These last words are really meaningful. Okay, so we'll be moving on to, oh, and Hannah does need to go in a couple minutes. So we just want to say thank you to Hannah. But okay, we'll be moving on to Brianna.
Okay, hey everybody. Again, I'm Brianna, third year college student at Cal State Long Beach School of Nursing. So a lot of what I'm going to talk about is going to be focused towards that program. But for the most part, CSU nursing programs are usually the same across the board. UCIs are a little more different in terms of requirements. Also, sorry, I'm going to overshot again. Yes, so first year nursing school in my second semester. So yeah, if you have questions right now, just put them in the chat, or anytime throughout my presentation, put them in, and then I'll respond to them all at the end. So let's start with the general pathway. What's really cool about nursing school is that we are an undergrad program. So unless you want to become a nurse practitioner, like Hannah was talking about, then you would have to go to a master's program, or you could even pursue a doctorate. But most, like getting your RN or your ADN license, it's just 4 years. So that's including prereqs. So first step is completing an RN program. I'd like to elaborate more on like pre-nursing, because I think that's like the stage that you guys are kind of in. So most colleges have either a direct or indirect nursing program. Cal State Long Beach is an indirect nursing program, which means that you will apply to the nursing school as a pre-nursing major. So we do have a pre-nursing, not like pre-med or anything, but pre-nursing. And what that basically means is that the college will prioritize you in like the types of classes that you're going to get, to make sure that you get into that so you can apply in the timely manner. Direct nursing programs mean that you apply from high school and then you get in. So as a freshman in college, you are already a nursing student. And a lot of private universities do that, along with, I think Cal State Fullerton still has their direct entry nursing program, along with San Diego State. So that's nice, because you can get like that like nervousness of like applying to the nursing program out of the way. But to get into the nursing program at Long Beach, you need to take 8 prereq courses. I think 4 of them are like your English classes, and then, no, 3 of them are your English classes, and then you have to take a stats class. And then the other 4 are your science. So you have to take a nursing chem that we call, and then 3 bios. So microbiome, anatomy, and physiology. Along with that, you have to take kind of like an entry nursing exam. It's called the ATITs test. At Long Beach, they say competitive score is about 90% or higher, so it is a little scary. But the good news is about Long Beach is that you don't have to volunteer. I know Cal State LA, they do require volunteer hours. I think it's like 100 or so. But at Long Beach, they focus solely on grades. And then after you submit all of those to your application, you apply your sophomore year, by the way, you get an interview from Cal State Long Beach. And then if you pass that interview, you are into the program. Our program at Cal State Long Beach is 5 semesters, or 2 to 2.5 years, depending on which course you want to take or which pathway you want to take. And that includes clinical rotations that can be from like once to twice a week. And then I think your 5th semester, you're doing it like 5 days a week with your preceptor. So once you finish the nursing program, you have to pass the NCLEX. So the NCLEX is basically our exit exam for nursing. There are about 75 questions, or at least 75 questions, and then they'll give you more depending on like where you're at. And I think you can have up to like 265 questions if you're like kind of in the middle of like, are you passing or are you not passing? So it used to be all multiple choice, but as of this year, they said that they were going to change it to be more like fill in the blank, and a lot of like charts where you like kind of connect lines and dots and stuff. So that's a little stressful, because we will be, or like my graduating class will be the first class to take that. So I will be in your guys' boat. Yes, so you take that NCLEX and then you get your license, which is fun. And if you want to become a specialty nurse, like let's say you want to go into the OR, you do have to take like a CNOR test along with the NCLEX. So you take the NCLEX and then you do some training usually at the hospital you get hired at, and then you take like a test at the end, like a certification test. So once you get that license, then you get a job, which is great. We love jobs. So yes. So elaborating more on the educational requirements for a registered nurse, you can either get an associate's or a bachelor's degree in nursing. The main difference between associates and bachelors is that bachelor's focuses more on leadership, and associates usually have more clinical experience compared to like bachelor's nursing students. And then professional diploma from a approved nursing program, that can be like your LVN, which is a licensed vocational nurse, and those are usually like 12-month programs. Associate and bachelor's programs are both around 2 to 2.5 years. It just depends on the school. I know there's one school in Nevada that's doing like an accelerated like 18-month program to get your BSN, which is super cool if you kind of want to get over school, you know. And then another nurse is the licensed practitioner vocational nurses. Oh, that was the 12-month thing I was talking about. So yeah, LVNs, they usually work in like clinics, nursing homes, and SNFs, which are skilled nursing facilities. Yes, and if we're good with that. So these are all types of nursing positions that are available. Nursing is great because there are just so many options of like what kind of nurse you want to be. Like if you're super, super like outgoing and all of that, you can become like, I don't know, maybe like a med-surg nurse or something with like 4 patients. Or if you're a little more reserved, you can always be IT or an OR nurse. So options are endless. And then there are different positions based on how much schooling you do. So a CNA is a nurse assistant, certified nurse assistant. They make about, like they say, 29K a year or 14 an hour on average. But I've seen it go higher because of COVID, because there's a really high demand for CNAs right now. And the good thing about CNA school is that it's usually around 6 months to get your license, your CNA license. And the exam is like a skills exam and a written exam as well. So you pass, or you take the 6-month course, you take the exam, and then you can become a CNA. A lot of hospitals will take CNAs who are like 18 or older. So when you guys graduate, if you want something to do over that summer and make some money and you're planning to become a nurse in the future, taking a CNA program is a really good idea. There's the LVN or LPN. So there's their median pay, that's how many jobs. And usually their classes are around 12 months, and then they also take their own exam. And then RNs, they make about 73K per year, and there are a ton of RNs, which is great, but we need more. They work at hospitals, SNFs, nursing homes, and a lot of people don't think about this, but they can also work at like in airlines. They can be cruise ship nurses. I've had a nursing instructor, my foundations professor, was actually a cruise ship nurse for the longest time, and she loved it because she was literally on the job and traveling like all around the world. So that's one thing that's really cool. You can be anywhere as a nurse, honestly. And then clinical educators can also be RNs. Their school's around 4 or 5 years, and then they have to take the NCLEX. And then lastly is the APRN, which is Advanced Practice Registered Nurse. They're kind of like PAs, like Hannah said, but again, they can open their own practice. And they actually, I think last year, they were approved to start giving prescriptions and all of that, so that was really cool for them. They mostly work at clinics and hospitals, and they require a master's or a doctorate. Some nurse practitioners, like the nurse anesthetist, starting next year, they will need a doctorate to become an anesthetist, which that's a lot of schooling, but they do get a lot of money, which is nice. So that's it for that slide.
Thanks so much, Brianna.
Oh, yes.
There are still questions in the chat, but in the interest of time, are you able to just answer the questions in the chat and then we'll move on to that?
Yes. Okay. It says.
Thank you so much. And then if there's time later, we'll try to answer. Did you have anything else you wanted to say? Sorry.
Oh, it's okay. Well, I was just going to add, just real quick, that we really, really need nurses. So anyone who is interested, even has a tiny bit of interest in nursing, I would really highly recommend that you join, because I have a mom who's in the OR and she's like suffering every day because like they have a huge shortage. And CSULB is an amazing program because we have a 95 to 100% in-class pass rate. And we have been consistently like top 10 nursing schools in California, according to like a lot of sources, which is great. And a lot of Orange County hospitals love CSULB students, especially Long Beach Memorial, because they will guarantee you a job straight out of graduation and they will pay up to 20 grand of your tuition. So yes, just wanted to add that for you guys. Okay, let's go to the questions. What are the differences between the nurse compared to MD? So we have this thing, there are two different models in healthcare. There's a like patient-centered model, and then there's like the disease-centered model. So MDs focus more on like diagnosing the patient. Here are the labs, here are the diagnostics, here are the scans. Okay, this is what the patient has, and this is how we solve it. The nurses are really the ones who are more upfront in like looking at the patient. Okay, this patient is having trouble breathing, what do I do? And this patient is in pain, what do I do? So kind of the main difference is that we are like looking more at the patient's like present condition rather than the overall like, okay, this patient has, I don't know, pneumonia or cancer. So that's what I would say is the difference. Is the nursing major as a pre-med a good option? Personally, I want to go into school. Would nursing be a good way to test my skills before committing to medicine? I actually know a lot of people who have gone into the nursing major to become pre-med. A lot of them, they say it's a good experience to be kind of in the hospital setting already. But like I said, with like the nurse compared to the MD, our brains work very like in very different ways. You know, doctors are more like kind of, I don't know, like here are the labs, here are the statistics, and then here's the diagnosis, whereas nurses are kind of like more, I guess, involved in the patient themselves. So it's all about like what your personality is. Like if you think that you can do a little bit of both, I think nursing would be really good for exposure into the medical field. There are a ton of other ways to get that exposure, like shadowing like people at the hospital and all of that. So I mean, I'd say do it. I think it's a good experience. And then Viri asks, would nursing school be good practice or a stepping stone if you want to be OB/GYN, or would I need something else? I say it would. I mean, of course, if you're going to be like a labor and delivery nurse, it's good to kind of see like what, like you're going to be working in close proximity to the doctor, so you'll see kind of what they're doing. A lot of nurses will become or not a lot, but like there is a pathway where you can become a midwife, which is basically kind of like an OB/GYN nurse. Like they can deliver babies, and they are, they can like, they do the checkup. So they're basically, midwives are basically practitioners, like nurse practitioners. They need a master's degree. So I think becoming like, let's say a labor and delivery nurse to a midwife and then to a doctor would be a pretty good route, I'd say. So yeah, I say do it. Thank you guys.
Thank you, Brianna. And Jennifer, do you want to talk about being a vet?
Yes. Hello, everyone. I'm Jennifer. I'm currently pre-vet, so I'm hoping to apply to vet school after I take 1 or 2 gap years, graduating this spring. Maybe the next slide. Okay. Also, if y'all have any questions, feel free to put in the chat, and then I'll probably type in the chat and reply after. With the general pathway to becoming a veterinarian, you complete high school, get your high school diploma, do a 4-year university to get your bachelor's. Some vet schools actually don't require that you complete your bachelor's or have a bachelor's degree, but most applicants do, just because it's the easiest way to complete all the prerequisites, complete 4 years of vet school, and then I believe in your 4th year of vet school, you take your veterinary licensing exam, and then you're officially a doctor of veterinary medicine. So some educational requirements, it's the general STEM classes, so like chem, organic chemistry, lab that goes along with those classes, biology, some schools require zoology, and then physio, micro, biochem, physics, and then physics lab too, I believe. And then humanities, your social sciences, genetics, mathematics. I know most vet schools require specifically calculus and then statistics, some English classes, and then animal nutrition specifically is dependent on which vet school you're looking at. So I know like vet schools in Texas do require animal nutrition. However, if you're from California, no schools in California that I know of offer animal nutrition. So you do have to take it out of state if you're interested in applying to that specific school and need to fulfill that specific requirement. And then same with like speech and public speaking classes. Some vet schools do require that. So I would highly recommend looking into potential management or business classes to qualify for that. And then another requirement is you do have to take a GRE, which is the graduate records exam. It's kind of like the SAT of college. It's more for general school. So it's like the MCATs for med school. The GRE can be applied for vet school. And then you do need veterinary hours. So the difference between veterinary hours versus animal experience hours. Animal experience hours is more kind of like volunteering at an animal shelter, whereas veterinary hours is like volunteering under the care of like a veterinarian or a DVM. So working in like a vet clinic itself. So that's a little bit difference between the hours. Different schools have different amount of hours required, but most range from 500 to 1,000 hours when they apply. And then Sophia listed some schools on the West Coast. There's only 2 schools in California, so that's UC Davis and then the Western University of Health Sciences. Yeah. And then there's different career options. Once you do have your DVM, most DVMs go into private practice. So for me personally, I want to be a general practice small animal. So I'd be working with your typical dogs and cats, your typical vet appointments, but also some other private practices can include like farm animals, marine animals as well. So it can vary depending on your specialization within veterinary medicine. You can also go into public health and work with federal or government agencies pertaining to like health and welfare of animals. There's also the option to go into researching about like animals and how to improve like diseases within animal care. And then teaching is also an option. I know a lot of retired DVMs that don't want to do general practice anymore go into teaching, and then teaching like vet techs as well. Vet techs are kind of like the nursing of veterinary medicine. But there's definitely a lot of different options within veterinary medicine.
And for lastly, did you want to share a little bit about why you got into to become a veterinarian?
Yeah, sorry, I was rushing a little bit. But I think for me, every time someone asks me why I wanted to go into veterinarian, it's kind of just because I've always loved animals growing up and I always really enjoyed STEM. So my 7-year-old mind kind of just put those 2 together, and I've been pre-vet ever since I was little. I considered pre-med for a little bit, but the big difference I think for me was for vets, you don't have to do residencies, which do take up quite a bit of time if you are pre-med or medicine. Vets, once you finish your 4 years of vet school and you take your licensing exam, you are qualified to be a vet and you can go straight into practice. If you do choose to specialize within vet med, you do have to do a residency. I'm currently volunteering at a vet oncology clinic. And so I'm working with vets that specialize in oncology. So they do residencies and stuff. Yeah.
Thank you so much, Jennifer. And lastly but not least, we'll be moving on to Gianna for dentistry.
Hi guys, I'm Gianna. I'm a second year at UCLA and I will be applying to dental school next year. And yeah, I'm so excited to talk to you guys about dentistry. So here's just a little sample timeline of the journey to dental school. So this is basically covering what most pre-dental students take during their undergrad years. This is by no means like every single thing that dental students do. It's just a couple of things that a lot of people do. So according to the ADA website, when you apply to dental school, you want to have 8 hours of bio, 8 hours physics, 8 hours English, and Gen Chem and OChem. And then each dental school has their own supplemental requirements. Some require microbio and biochem. It just depends on what dental school you're looking into. So basically year one, you kind of just focus on your classes and you start getting into volunteering, you start shadowing, and a lot of people recommend shadowing mostly general dentists first because when you're applying to dental school, they want to know that you're interested in general dentistry, not like specifically, not a specific specialty, but it is important to look at different specialties just so you get a feel of what you're interested in. And then in your second year, continue volunteering. It's optional to do research. You definitely don't have to, but a lot of dental schools do appreciate students who take the initiative to research. And then typically after year two is when a lot of students either take the DAT or start studying for it. And year three, you can also take it. It just depends on whether you want to do a gap year or not. A lot of undergrads do a gap year before they go into dental school because the first year dental school is pretty intense. So you kind of want to have a little break between college and dental school. And so yeah, after year three, if you're planning on attending dental school right after you graduate college, you're not taking gap year, you want to apply to dental school after you're done with year three. And so in the dental school application, you need to have volunteering hours, and this doesn't have to be only related to dentistry. It can be anything that you're interested in. Like if you're interested in helping out at the hospital, that's perfectly fine. Also, just any sort of volunteering or helping in the community. And in addition to volunteer hours, you have to have a minimum of shadowing hours. And as I said before, dental schools prefer to have general dentistry shadowing, but specialty hours are also helpful to have on there as well. And just like your college applications, they'll ask a few questions. And there's basically 2 rounds of dental school admissions. The first is when you send in all your information, like your volunteering, shadowing, essays, all that. And then the second, the dental schools will ask you for some supplemental information, supplemental questions. Some will invite you for interviews. And yeah, and then fourth year, you just do interviews. Any additional requirements, like if you wanted to shadow more, if you wanted to work as a dental assistant, just get some more experience. And then dental school in the following year, or if you want to take a gap year. Yeah. So basically, I'm sure a lot of you know what a dentist does, but here's a couple of their main roles that they do: diagnose oral diseases, promote oral health and disease prevention. So they educate patients on oral hygiene and dental care. They examine their teeth, obviously, and identify or diagnose any potential dental problems that a patient might have. They perform dental procedures such as some fillings, tooth extractions, tooth alignments, teeth whitening, just to name a few. We also get to use x-rays and different tests to get a comprehensive overview of the patient. We keep records for every patient. We ensure the safe administration of anesthetics. So yes, we get to put in anesthetics in people's gums, which is pretty cool. We monitor growth and development of the teeth and jaws. This is especially important for pediatrics if you're interested in specializing with little kids. and perform surgical procedures on the teeth, bone, and soft tissues of the oral cavity. So if you're interested in surgery, you can also incorporate that into your own dental practice. And as a general dentist, you don't have to do all these procedures I'm listing. You can choose what you want to do. Like if you're interested in doing root canals, for example, you love root canals, you can do that a lot in your practice, and your practice can be known for root canals. Or if you're interested in working with kids, you don't even have to specialize. You can just work with kids, just advertise that in your dental practice. Yeah. Here's some of the career options. So you can go into private practice. So basically, this is a major reason why a lot of people want to become a dentist. They get to own their own practice. You get to work with a whole staff of people, work with dental assistants, dental hygienists. Super fun, super exciting, have a little family there. Academic dentistry at a university. So you get to teach dentistry to dental students at a dental school. What a dental. Public health dentistry. So you can work on an Indian reservation, Coast Guard base, and Navy, even imprisoned, which is very cool, giving back to the community. Research. You can become a faculty member at a university, work in a private industry, and all those. International healthcare. I was actually looking into this recently. You can travel abroad and provide dentistry in different places. But a thing to keep in mind for that is that there's different dental certification things required for each place. Like you might need to get a different license, or et cetera, but that's just one option. And then hospital dentistry, treat patients with other medical conditions. And sometimes general dentists just go to the hospital infrequently just to do like any procedures with patients with disabilities or patients that need further help, like they have certain medical conditions that they can't do a dental procedure at the dentist's office. And yeah, that's just a couple of the options. Oh, and you can also specialize. So after dental school, there's a bunch of different specialties you can go into. Just to name a few, there's periodontics, you get to work on the gums. Pediatrics, like I mentioned, get to work with little kids and also get to work with people with disabilities. Ortho, I'm sure a lot of you guys have experienced that. Braces. What else? There's a lot more, but there's plenty of options in dentistry. And even after dental school, if you don't want to go into one of those labeled specialties, you can take courses yourself and get certified in different things. Like you can get certified in Invisalign, you can get certified in Botox, which is kind of crazy. That's like part of dentistry, but you can do it. And yeah, there's a bunch of different options. Yeah.
And then lastly, do you want to share just how you got into dentistry?
Yeah, for sure. Kind of random, but in middle school, I was like told to like look at different careers, and we had this project where we had to like design our life by 2030. This was in middle school. Anyway, so I was like starting to look into the health careers and like all that stuff, and I started looking at dentistry. And I got really interested because they had like a really good work-life balance. The hours are very good. You can basically like, a lot of the times you can set up your own hours. Like I know some dentists who work like 4 days of the week and have a 3-day weekend, which is nice. And some work just every day, 9 to 5, and then just take long breaks. But yeah, super good work-life balance. You get to use your hands, which is really cool. You get to make people smile. You get to meet new people. There's a whole bunch of stuff. But yeah, I would recommend shadowing if you guys are interested. And yeah, if you have any questions, just drop them in the chat or ask me. Yeah.
Thank you so much, Gianna. And I want to be wary of our time. So it is 5 o'clock. So if any of the panelists or any of the students need to go, you're free to go. Thank you so much for coming.